Good afternoon, everyone. Thank you so much for joining us today at our Southern Cross University 2023 Open Day. We are very pleased to have you join us. My name is Candice. I'm a student ambassador here at Southern Cross University, and I'm also going to be the host for our naturopathy and osteopathy panel. So I'm joined by some incredible panelists today who are going to share some insight and experience about their degrees and what areas they work in. Could I just start with getting you to tell us a little bit about yourself and what your connection is with Southern Cross University?
Hi everyone, my name's Sam. I'm currently doing my Masters in Osteopathic Medicine, so that means I'm in my 4th year of full-time study. I'm obviously a mature student, I have a 12-year-old daughter, and I have a background in personal training and Pilates teaching.
My name's Chris. I'm probably 4 or 5 years into teaching here at Southern Cross University. I studied the course through Southern Cross University. Prior to that, I was a remedial massage therapist, so I have a background in the manual therapies. So spent a long time in that sort of patient management education. Also, 2 kids, there's a busy life at home, but this is quite a passion for me. So I really enjoy the teaching of what I do. So yeah, it's great.
Hi everyone, I'm Rebecca. I'm an Associate Lecturer and Course Coordinator for the Bachelor of Health and Lifestyle degree at SCU. I've been with NCNM for 3 years and I teach in both the Bachelor, the Masters and the Advanced Naturopathic degree. I am a naturopath. I graduated in 2014, but not from SCU. I'm not in clinical practice. I primarily focus on teaching and research in naturopathy both nationally and internationally.
Hi everyone, my name is Andrea. I am also from National Centre for Naturopathic Medicine. My journey is a little bit different. I was actually, by training, I guess, a scientist. I have a PhD in molecular virology. I was a postdoc for a number of years and then I moved into some teaching and education leadership roles. I've been at SCU for about 3.5 years. I've been involved in designing and delivering of all of the centre's degrees, bachelor and multiple master's degrees as well.
Wonderful. Thank you so much, everyone. So I'm going to stay with naturopathy. So can you start by telling us a little bit about what naturopathic medicine is and how that fits within the Australian healthcare system?
So naturopathy or naturopathic medicine is a traditional system of medicine, and that means that we utilise our clinical knowledge, our history and our philosophy in a very holistic approach to care. I guess in terms of how it fits within Australia is a little bit different from other countries. So we're an unregistered profession, but we primarily focus in working in private clinical practice. There's maybe about 5,000 naturopaths actively working in clinical practice at the moment, but we mainly focus in looking at different patient care from a chronic and acute perspective and using all of our philosophical frameworks to support patients.
Wow, very interesting. Thank you. So for osteopathy, Southern Cross is just one of the 3 universities in Australia that actually offers osteopathy. Can I start by asking just to briefly explain what osteopathy is and what osteos do?
It's a good question. It's one a lot of people ask, what is an osteopath? Unless you've come across one personally or family and friends, it's probably a bit of a tricky question to answer yourself, but we are a complementary medicine as well in Australia, and also different in Australia than some other countries like the United States. They are also medical practitioners. So here in Australia, we are allied health practitioners, so we work alongside podiatrists and naturopaths and nutritionists, physiotherapists, chiropractors, and similar to the naturopathy profession, we have a holistic approach to healthcare, so considering the biological, psychological and social aspects to health and disease. And most that have experienced treatment from an osteopath would probably consider it to be quite a hands-on or manual therapy approach, though there's exercise prescription, pain education, lifestyle education and advice as well. But in terms of the actual practice, a lot of us are in private practice, whereas physiotherapists you might find in hospital settings as well. So the majority of us are in private clinics and a lot of hands-on sort of approaches to treating pain and other musculoskeletal complaints.
Wow, thank you so much. So, Sam, my next question is for you. Why did you choose to study your degree?
Good question. I chose osteopathy because for me it was just a natural progression. I'd spent 25 years as a personal trainer, heavily invested in health and fitness. All the evidence coming out points towards how critical exercise prescription is, and yet I felt I just needed another layer, a deeper layer, to really be able to actually diagnose, not just suspect things, to have the tools to be able to diagnose people's conditions, pathologies, injuries, and to be able to pick up on things that I just didn't have the knowledge base for. So it gives you a much deeper understanding of anatomy, physiology, the human body, and just so much more that I never even knew I was going to learn. But yeah, it's been a journey, but a fantastic one.
Oh, that's so good to hear. So based on that, what is the thing that you enjoy the most about your course?
The course is very hands-on. I love that because I'm a very hands-on kind of person. I always have been. It's very physical without meaning I have to go running around the park with clients. So as I'm getting older, it's the perfect transition for me. It really means that you can connect with your patients and get a sense of really truly helping them. And that's, for me, what it's all about, helping people and bringing them back to wellness and to health.
That sounds very rewarding. So with naturopathy, can students exit the bachelor degree just after 3 years? And if they do, what do the career prospects look like from that?
Absolutely. So completion of the bachelor means that you can start working in different community settings. So you could look at allied health, you could look at different clinical practice settings, health promotion. We do have a lot of our units focus on health promotion, and that's a very philosophical driven part of naturopathy, so that would be another area that you could work in. And if you really wanted to become a clinical naturopath, I guess that the great thing is some of the units in the bachelor are going to prepare you for that. So we have our clinical studies units, and that would be used to help traject you into the Master of Naturopathic Medicine. So you would complete the second year of the Masters, and then you would not only become a clinical naturopath, but you've completed a Bachelor of Health Science and a Master's in Naturopathic Medicine, and that is the highest qualification in Australia you can get as a naturopath.
Okay, wonderful. With osteo, is that the same? What does the qualification kind of look like? How do you actually become an osteopath?
Yeah, good question. So in Australia, osteopaths are also university trained. So it used to be a 5-year degree. It's evolved slightly over that time, and a lot of the units have become a bit more specialised towards the degree itself. So it's a bachelor's first. So there's a 3-year undergraduate course or a bachelor's of clinical sciences, which we progress through alongside a lot of the other health faculties in terms of anatomy, physiology. And then there are some more specialised units. So we go through the 3 years of the bachelor's degree of clinical sciences, and then there's a year and a half in the Masters of Osteopathic Medicine, where that becomes more of a clinical course where there's a lot of placement. There's the in-clinic placement where you're actually hands-on with patients. And then there's a research component as well. So it sort of takes everything we've learnt through that bachelor's and then applies it in a clinical and practice setting. So it really ramps right up in that master's. So in terms of the leaving after a bachelor's, that's not something we do with osteopathy. Even though the course, there are units that are sort of weaved into the bachelor's specific to osteopathy. There's not a particular degree that you will walk out with at the clinical sciences where you can become an osteopath. So you'll need that master's to transition to an osteopath in private practice.
Okay, great. So we've heard a little bit about that there are practical components and placement components. Sam, would you be able to tell us a little bit about your practical experience that you have had while studying so far?
Yes. So in third year, I was allocated 1 shift a week at the health clinic that we have here on campus. And if you haven't visited it, it's over in the blue building, Building B, on the ground floor. And it's a fully kitted out health clinic that's open to the general public. So people can book in and say, yep, I want to come and see the speech pathologist, or no, I want to come and see an osteopath. And they would book in with a student in the knowledge that we are supervised by fully qualified osteopathic practitioners to guide us through that consult. So it started with 1 shift a week. Now that I'm in my 4th year, it's 2 shifts a week. That means 2 days a week for the whole year. And in addition to that, we also do external placement, which means I contact an osteopath up in Southport or up in Brisbane or down in Sydney, and I say, hey, I'm a student, I'd love to come and observe you. And if they agree, then I would go and spend a day or half a day observing them and seeing how they do things. So it's a great learning experience, because obviously no 2 practitioners are exactly the same, so it gives you a much greater understanding of, you know, how you want to operate as a practitioner once you graduate.
It sounds very practical, which is a great way to learn. So is that the same with naturopathy? Is there placement experience? Is there a lot of practical components as part of, you know, the courses?
Yeah, so the undergraduate degree itself starts with having some massage mind-body units. The clinical studies themselves teach you everything from pathology, clinical examination. Everything is sort of integrated within the clinical studies. So you really have a hands-on approach to health, literally as you walk in the door. The placements themselves, we have an 8-hour observational placement in one of the first units that are naturopathic medicine. It's an observational placement, so you go in and see a naturopath and observe how they work as a naturopath in clinic. And then the actual clinical hours are in that 4th year. So the Master of Naturopathic Medicine, we have about 540 clinical hours, which is the most that you can get in Australia. And we've kind of divided that into 3 groups. Most of them are here actually in a health clinic, the SEU clinic, the same clinic that was just mentioned. Then you have some hours in external placements, and those external placements are in specialised healthcare settings. So you'll go and, for example, work in acute care or palliative care as a naturopath, or in rural and remote where the greatest need is really for naturopathic care itself. So we prepare you, I guess, within the clinical hours, so that you really are walking out as prepared as you can possibly be as a clinician into the world of not just primary healthcare but also specialised cares.
Yeah, so both of these degrees are definitely very hands-on and practical learning experience, which, like we've mentioned, is a great way to be able to study. What do you think makes a student really suited to your profession? What kind of characteristics do they need to have? What attributes, make them a really good practitioner?
I think a lot of it is going to be the alignment to our philosophies. I'm a big believer in naturopathic philosophy. A lot of naturopaths, of course, are. That's how we practice. But from a personality point of view, it's about being empathetic, having compassion, and not just for, I guess, that clinical understanding of the disease process that's sitting in front of you, but that is a human being, that is a person, and having that care provided to them based on the compassion and empathy that you have. So of course you do need to have clinical knowledge and, the clinical smarts, but it's also about making sure that you can treat holistically by understanding people and not as a patient.
I'm pretty sure you just answered our question for us as well. I'd say it's very similar in the sense of wanting to help people. The majority of, I would sort of say, arguably, the majority of people that fall into osteopathy have experienced it themselves. They've had an injury, they've had some sort of trauma or experience in their life, they've seen an osteopath and they've had a brilliant experience with it, and they've gone, I want to do that, which is sort of how I fell into the study of doing it as well. So, caring for people, wanting to help people, but also having an interest in the body, the science of that, because there are a lot of clinical components, and I would also say that by far, across all the years I've been teaching, you sort of see that a lot of the osteopathic students are just so invested in wanting to learn and enthusiastic about that, whether it's the clinical sciences, whether it's the core units of the anatomy. But there's that interest in the science as well as applying it to health and helping people. It's good.
No, very good advice from all of you. So, Sam, based on being a student and hearing that kind of advice, if you were to go back in time to before you started studying, what advice would you give to your past self or to a future student who's looking at getting into this area of study?
I wouldn't change a thing, except I would say don't do this degree unless you have a burning desire to understand the human body a bit more. Because you need to have that passion, otherwise this degree is challenging. If you have a real desire to understand the workings of the human body a bit more, and you could spend 10 lifetimes learning that, but if you truly have a passion for that and wanting to help people, then give up 4.5 years of your life, because it will change your life. It's brilliant.
And what is your main goal once you finish studying?
I would like to go into private practice. I would also like to see a future in Australia where osteopaths maybe have a role in hospitals like they do in the UK, where I'm from. But that will be a discussion for another day. For the time being, I think, private practice is the way to go, and maybe finding some integrative clinics that offer multimodalities, because multimodal of healthcare is, a really good way to go. So you don't just see a GP, you don't just see an osteopath, you don't just see a naturopath. You get the full gambit of healthcare from multiple directions.
I would like to open the floor to anyone who might have a specific question to a panellist. I would like to give everyone an opportunity to ask something. Yep. So the question was around, how does it work if you wanted to travel overseas?
I guess from a naturopathic point of view, I know the Australian naturopathic degrees, you can actually go practice in Asia. So we have a couple of students that have been working in Singapore and Hong Kong, for example. In the US, it is a little bit different. So they do have a different scope of practice, and they do have different registration models. So I guess it would depend
on different states have different, but Canada is pretty similar to us. So Canadians and Australians are pretty on par, and states not so much. Germany would be a good place for Europe, but the rest of the European states probably is a little bit of a hit and miss. So if you want to go to sort of North America, Canada is your best bet, and Europe, Germany's your best bet.
And from an osteopathic point of view, I can answer with some confidence, because I have looked into this. If with my master's degree in osteopathic medicine, if I wanted to go and practice in most of Europe, that would be completely fine. I would just need to get a solicitor to transcribe my details of what I've studied here. The Australian degree is held in very high regard in both the UK and Europe, probably in a higher standard than they offer. So there would be no need for any bridging courses or any other additional, make up the gap sort of stuff. But I know it's completely and utterly different in the States, in America. We get automatic registration in New Zealand. So if you were looking at going across the pond, it's easy, it's automatic.
So I actually have had some colleagues move to Canada and just continued practicing, as well as New Zealand. And yeah, same with Europe. I actually had a friend of mine who lived in France for about a year ago, and just continued practicing.
It's definitely a thing for naturopaths as well. Sorry, I actually forgot. Trans-Tasman. Yes, in New Zealand you can definitely just walk into practice.
Wonderful. Is there anything that you guys would like to add? Is there anything that I've kind of missed that you think is a really integral part of the degree or the course that you would love, a future student or someone who's looking at having a career change to think about?
When it comes to naturopathy specifically, and it sounds like osteopathy is on the same page, naturopathy kind of brings together science, healthcare, empathy, everything in the same space. So you really want it. And the best naturopaths are the ones that are really looking at things holistically, literally from day one. As you walk in, you're looking at the body from a holistic perspective. You're looking at the treatment from a holistic perspective. You're looking at a person. Always looking at a person first and what they're after. You're there to guide their healing journey. You're not there to be the be all and all. And that's what the degree, both it sounds like osteopathy as well as our degree, is going to teach you. Things will collide. Science will collide with your empathetic selves, but you have to be kind of thinking from both ends to be a great clinician.
Wonderful, thank you. So unfortunately that is all that we do have time for today. So we wanted to say thank you so much for joining us. Our panellists will definitely stick around in our student garden just outside near the registration desk, and they can continue to answer some more personalised or broad questions about the courses. So I wanted to say thank you so much, everyone, and thank you to all of you for joining us today. We are very much looking forward to seeing you on one of our Southern Cross University campuses very soon. We have a team out there, our future students team and our admissions team. Today is a perfect opportunity to start your application. If you're a school leaver, start your early offer application with us, and we can get the ball rolling for you. And we hope to see you very soon. Thank you.